Good morning and happy Tuesday, everyone. Buenos días y bienvenidos. I'm Esme Villarreal, your very proud president and CEO for your local chamber, the Brownsville Chamber of Commerce. We are diligently working to continue to serve our businesses as a resource for fact-based data, information, and education on COVID-19 resources for business sustainability. As we all adapt to this unprecedented situation, we're forced to rethink and adjust our business model by fast-tracking digital transformation. Welcome to our 5th webinar for Brownsville and Beyond series. This webinar series will navigate the reopening of the Texas economy by addressing potential challenges we will be met with along the way. We invite you to use the Facebook and Zoom chat to communicate your questions. Quick reminder, we are live, of course, through Facebook, so do share this with your fans, your colleagues, share it on your business page, and of course, those that register through Zoom, feel welcome to send us your questions through Zoom. Today's topic is healthcare in the age of COVID-19, and with us today, we have the honor of having Leslie Bingham, Senior Vice President and CEO of Valley Baptist Medical Center, Brownsville, and Art Garza. He's the Chief Executive Officer of Valley Regional Medical Center, which will be discussing the One Voice for Healthcare message, addressing hospital capacity, the possibility of a second wave threat, and much more. Before we begin today's program, I would be remiss if I didn't acknowledge and express our sincere gratitude and support for all the employees on the front line of defense against COVID-19. From the bottom of our heart, we thank you, and we thank the thousands and thousands of healthcare and unsung heroes battling this global pandemic. You are the heart and soul of the war against COVID-19. Through this pandemic, we've experienced unity and resiliency as the world has come together as a collective force, and Brownsville is no exception. We are Brownsville strong. We have seen our community. We've always been a very close community. We've always been very supportive of each other. But what COVID-19 has brought has really been an eye-opening experience. I am so humbled to serve. Our team here, and of course, our board of directors, we're humbled to be serving our business community. We're very proud of everyone in our community, from our elected officials, our city management, of course, office, from our city employees, our nonprofit organizations, and most importantly, our community itself. The constituents of Brownsville have come together as one strong voice. I know that everyone, in one way or other, that we're all helping our neighbors, our family, by going and shopping for someone that can go shop, by not exposing the children and of course the elderly, to others that perhaps, may not know that they've been, of course, now a victim of COVID-19. We take this very seriously, and we as a chamber are working very hard, directly and indirectly, to continue to serve you and bring you information that could be of great use for your business and of course, for your homes and your families. We, as I said earlier, we're very thrilled and happy. And, I called both Leslie and Art great friends and colleagues. I always have the opportunity to reach out to both of them, and they never hesitate, to take the call or never hesitate to help their chamber and overall the business community. On a personal level, I am very grateful for the service that both Valley Regional and Valley Baptist give to our community. I unfortunately have had multiple experiences that I have to, be for months, perhaps at either or hospital. And, I can't thank you enough and your team for what you do. You are heroes in those ER, departments. Your team, they're always willing to help without hesitation. From the bottom of my heart, thank you to both, and thank you to your nurses and to your doctors. You do save lives, and I am forever grateful for that. So as I said, I'm excited to welcome both. And I know everyone is, because they're great community leaders and they're very involved and they have so much to talk about all the time. So before we actually started the conversation and when we went live, Art was asking if it was okay to drink coffee, and it is okay to drink coffee or water or whatever that may be on the other side. Leslie, you too, because I know that it's been such a tough journey, and every now and then we also need to relax. So today's objective is to have a very casual conversation to really speak about what's happening in their hospitals, and also to inform ourselves of what we can do to support this, to support and make sure that we do not contribute to the spread of COVID-19. So we'll start, of course, with the introduction of Leslie. I always tell Leslie, when, I don't know what her secret is, but I do want to be like her. Every single day I see her actively walking in her beautiful downtown, and I really admire her, but I admire most that she's a very fierce leader, and this is of course no exception, and her team are continuously fighting COVID-19. Leslie is the great leader of Valley Baptist Medical Center, and she is a vice president and CEO. She was shortly after the acquisition of the Brownsville Hospital in 2004 and the hospital's reorganization. Leslie was appointed Chief Operating Officer. She was then promoted to the role of Chief Executive Officer for Valley Baptist in 2006. She has over 30 years of experience as a leader and executive within the healthcare industry. She also holds a Bachelor of Arts in Education and a Master's in Education from the University of Mississippi. She also earned her MBA from the University of Texas Pan American. And in January 2008, Texas Governor Rick Perry appointed Leslie to the board of the Texas Department of Housing and Community Affairs. The TDHCA is responsible for providing affordable housing, community and energy assistance programs, and colonia housing activities. Additionally, the agency annually administers more than $750 million in federal grants, federal tax credits, and mortgage revenue bond financing. She has chaired the board's audit committee from 2014 to 2016 and is now serving as vice chairwoman of the board. Committed to serving our community, Leslie has served as a board member and officer for the Easter Seals of the Rio Grande Valley and the Children's Museum of Brownsville. She's also a graduate of the Leadership Texas class of 2006, and she currently serves on the advisory board for Compass Bank, Vida, and her local homeowners association. In addition, Leslie served as a member of the Policy Development Council for Texas Hospital Association and has held board positions in the San Benito Rotary Club, the San Benito Chamber of Commerce, the Valley AIDS Council, McAllen Rotary Club, and the Cameron County Children's Advocacy Center. Leslie has two beautiful kids, Alexandra, who is now 28, and John, who is 17. Our other great speaker and great friend of your local chamber is Art Garza. Art is a native of Brownsville, Texas. He's the Chief Executive Officer of Valley Regional Medical Center. His career in healthcare spans over 28 years to include military and civilian service. As an early careerist, Art was a multimodal, Art, such a great bio, I'm stuck here. Art was a multimodal Model T radiography technologist. That's why I'm not in healthcare. After completing his graduate studies, Art was promoted to the level of associate administrator and eventually became a chief operating officer with the Hospital Corporation of America, HCA. Art is a graduate of the University of Texas Medical Branch at Galveston, as well as the University of Phoenix, and is a fellow of the American College of Healthcare Executives. He's a member of the Medical Group Management Association, National Forum for Latino Healthcare Executives, a board member of the United Way of Southern Cameron County, and a board member of the Texas Southmost College Foundation, and a former board member for the Brownsville Chamber of Commerce. Art and Leslie, thank you so much for being with us today. We know that, you're running the show, for lack of better words. We know that you're extremely busy, and we do appreciate you taking time to join us and, of course, informing our business community of what's happening, of course, in your hospitals. Leslie, can you see us?
I can see you.
I don't know. Yes, perfect. I'm sorry, I couldn't see you.
Good morning.
So, good morning to both.
Good morning.
Good morning, everyone. Happy Tuesday morning, Brownsville.
Thank you. So I guess we can start if that's okay with you, because we do have a set of questions, and I know our audience, may have some questions as well as we go through our program this morning. So this question, of course, is addressed to both. Leslie and Art, can you tell us about updates regarding your respective hospital and how you have been impacted by COVID-19 pandemic?
Great. Art, I'll get started, and then you can follow up too. There's so much that's happening that's similar at both hospitals, but maybe what I'll do is start first with the impact kind of that it's had, and then I'll talk a little bit about status. So I'd say the impact from late February until probably late April, I think our lives have just been a whirlwind in healthcare. Pretty much, I'm going to say completely consumed with the pandemic. And so because things were so rapidly changing, we almost had to kind of put to the side a lot of the other things in leadership that we do kind of to run our business. And I know that this is true for Art just because he's on all of the same calls that I'm on, but I would say from maybe about 6:30, 6:45 in the morning until sometimes 6:30, 7 o'clock at night, we spend a good bit of our time on phone calls, getting status updates, learning new policies, new processes, understanding what's happening in the Brownsville community, in the county, in the state, in the nation, and really across the globe. As we all, we're trying to learn from what others that had gone before us, whether it was a couple of months before us across the globe, or a few weeks before us in some of the larger cities in Texas. So I would say somebody that's running a business from late February to late April, I was pretty much 100% consumed with that. Now, since then, since Governor Abbott has started moving to reopen the state, I'd say we're adjusting to kind of what I'm gonna think is a new normal. Definitely still top of mind is the pandemic response and the hospital's responsibility to the community, but also really trying to work back to doing the things that we've always done for the community in terms of the other healthcare services that are provided by our hospitals, by our other associated businesses, by the physicians that work with us, and that kind of thing. So it's been, it's been all consuming, and now I think we're trying to find where business in terms of healthcare is going to operate kind of, because of the pandemic. In terms of status, I hate to talk about waves because people are talking about first waves and second waves, and it may feel a little, contrived, but it does kind of feel like an ebb and flow. So we've just, at Valley Baptist Brownsville, we've just come off of a really busy last 10 days, far busier than we had ever been before. And to some degree, I think the hospitals in the community are barometers. We may be, if businesses talk about leading indicators and lagging indicators, hospitals and how busy we are may actually be lagging indicators for what COVID-19 is doing in the community, right? Because if people are getting infected and people are starting to get sick, by the time they show up at Art's or my hospital, they're pretty sick. So if our hospitals are busy, then that's probably an indication that some period of time before then was when the rest of the community was probably more active in whatever that transmission of the virus was. So who knows, whatever was happening, whether it was Easter or, whatever was happening a few weeks ago, it definitely left the hospitals really busy for the past several days. Today, and one day does not a new wave make, but today we seem a little bit calmer. I'd say the number of patients that we're taking care of that are COVID related are about half of what they were this time last week. Still continuing to be really cautious about that. I know there's a lot of data flying around, and so probably our viewers are getting plenty of data. But just in terms of what the hospitals are doing, we've probably seen 150 patients that have been sick enough to be in the hospital. We've probably seen 10 times that many that weren't sick enough to be in the hospital but came through the ER because they had the telltale symptoms. It'd be hard for us to say how many of those were actually positive because for reasons that we can discuss later or not, our testing inventory hasn't been to the extent where we could test everybody that came to the hospital that was worried about if they had COVID-19. We only test the ones that are sick enough to actually be treated within the hospital. But of those, at this point, we've probably had 50 patients in the hospital that were positive for COVID. And then, like I said, it probably wouldn't be unusual at all for the number of patients that may have had it that weren't tested because they weren't sick enough to be a large multiple of that. We were on a call this morning, one of our regular calls with city leadership. And I mentioned that we had 6 deaths that were COVID related here in the hospital, and I think that took some of our leaders by surprise. The deaths are reported by the county. They have to, so deaths and positive cases have to be confirmed by the county before they can be reported, and so sometimes there's a number of days lag. So during that time that the hospital was very busy over the last 10 days, we did have a few folks that unfortunately passed away as a result of COVID-19. So I'm not saying that to scare anybody by any means. Hospitals are places where unfortunately people get sick and pass away. But I do think it shines a bit of a light on, this is our city, this is our hometown. Every single person that passed away was somebody's abuela or abuelo, or somebody's aunt or uncle, somebody's mother or father, and so it's really unfortunate that we've had that much of a loss. We continue to refine the hospital team. I really thank you for all of your recognition, Esme, for our healthcare workers. And I'm at the bottom of that list. Everybody else is above me in terms of hero status. But we really have had some amazing healthcare workers, from our doctors to our nurses to other healthcare professionals, even to the people that are cleaning our hospital rooms and feeding our patients. All of those people show up at work every day with game faces on. None of them have shied away from this, and obviously it's serious and it poses a risk to anybody that works in the hospital. But they've really been amazing through this whole thing. We've learned a lot together, and we're in a really good position to continue to take care of the community. But thanks for asking.
Thank you, Leslie. And this allows us, and that's the purpose of today's conversation, to really get to hear your stories, for us to really understand what's happening behind the scenes. It is very unfortunate, the reporting of those 6 deaths. Of course, we express our condolences to those family members. As you well said it, they're part of us, they're part of our city, they're our people, and it saddens us to hear of those news. Again, we wish them the very best, and our condolences to everyone. Art, have the spotlight. I know you hate the spotlight, but please, we can't wait to hear all about your hospital.
Esme, you know me too well. Certainly, I hate to be in the spotlight, but this is one of those moments in which I gladly step up and want to highlight to our community the things that our hospitals are going through. And while there may be some unfortunate circumstances, there's definitely a lot of great care that's being provided by both the Valley Baptist team and their doctors, as well as the Valley Regional team and our doctors. Before I go on any further, once again, thanks to the Chamber. Thank you, Evie, for allowing me the opportunity to participate on the session. You know, it's funny. I was thinking how I would respond to your question. And the only way that I can summarize it is that the more things change, the more they stay the same. And a reason why I say that is because the hospital structure maybe has changed just a little bit, but operations continue just as they always have. You know, we're still seeing patients that are COVID-related patients as well as everything else. And so that's a really important message to dig into in just a little bit further down our time together. But, you know, I think over the past couple of months, the things that stand out the most is how resilient our professionals have been and how adaptable we all are as a human being, right? But more so as healthcare professionals. Early on, and by early on, I'm really referring to maybe the beginning of March, right? Exactly when all of this started, really hard to tell. But when it really caught our attention was probably beginning of March. And if you remember back then, there was so much misinformation. It was really hard to believe, you know, or trust the different outlets of information. You weren't really too sure whether you should be trusting Fox or you should be trusting CNN. Everybody was looking at the CDC, but even then they came under fire. And so you fast forward a couple of months, and what we all knew very little of, we're beginning to understand a little bit better. And you know, you think about the fact that this has never been experienced before. There are no rule books, there are no protocols. We're developing it as we go along. It highlights the fact that together we are definitely stronger, and together we will get past this. And as I've mentioned to our hospital team, you know, 5 years ago, we were talking about Ebola. And before that, you know, probably it was H1N1. And if you go back to 20 years ago, it was HIV. And from what I understand, this is probably one of those viruses that will never go away. It'll probably be in our communities, you know, going forward. And we'll learn to live with that. And we'll learn to, you know, fight it better, understand it better, develop the vaccines against it. But this is one of those things where, you know, we are learning as we go. And so that's a little bit of a different situation, but the fact that we're still providing care for our patients remains the same. So it takes me back to my opening statement that sometimes the more things change, the more they stay the same. You know, our numbers between the hospitals have been surprisingly close to each other. You know, as I think back to the beginning of March, we've tested, if my notes are right, just a little over 450 patients altogether. And so those are patients that have presented to the emergency room. They may or may not have been admitted, depending on their condition. Those are patients that are under our care, admitted to the hospital. May involve a small contingent of patients that have been retested, because that's part of our protocols to make sure that our patients are progressing in the right direction. But altogether, about 450 patients. And out of those 450 patients, we've seen 35 patients. Currently, as of today, as of 7:30 this morning, and mind you, the numbers change daily. And sometimes they change multiple times throughout the day. We have 10 positive patients. 3 of those are in our ICU, and 7 of those are in our non-ICU COVID unit. And then we have 5 PUIs, and out of those PUIs, 1 of them is in our non-COVID, in our COVID unit, and the remainder are in ICU. So without a doubt, we are seeing numbers that are important, numbers that should mean something to us. You know, and when you look at the prevalence rate between our county and maybe other parts of the state, or as the state itself, or even as a country, our prevalence rate is an important factor, because it should tell us that out of all of the people in our community, we have a decent chance of continuing to see this disease in our community. Now, there's a lot of questions around how do we prepare for the new normal, and the reality is that it's kind of hard to tell because we don't really know what the new normal is. I will finish by saying, the new normal, at least as of today, has made for some really, really important relationships. The teams that support both hospitals, the EMS teams, the fire teams, thank God for them, because they're the ones that are bringing patients back and forth between the hospitals, nursing homes, private residential areas. And without them, there's definitely, we would definitely be at a disadvantage. Also, the collaboration of city leadership, when you think about how the mayor is doing his part, the county judge is doing his part, council members are very informed and engaged, and they want to know the latest information. That tells me as a business leader that our leadership throughout the city has their head in the right place and is interested in the greater good of our community. There's been a lot of support through those two structures, and so that's very important to note. But I'll tell you that going forward, regardless what the new normal is, the relationship between the hospitals has become so much stronger, and because of that, the community wins. Without a doubt, the community is better off because of our symbiotic relationship. I'll finish by saying that since the beginning, Leslie and I have been on the phone, texting, calling, sometimes daily, and many times, multiple times throughout the day, making sure that I know what she knows and that she knows what I know, because information definitely is extremely important during these times of uncertainty. And so I'll say that, in the past, we've always been competitors, and chances are we'll always be competitors. But when it makes sense, we put our hospital agendas aside to make sure that our community is better off. And this is one of those examples in which our community really should be proud of the way our doctors have come together, our healthcare professionals have come together, so unselfishly and so committed and so engaged in providing direction and leadership as physicians, as the teams do their best to execute those orders and therapies, and as we as hospital administrators pay attention to everything around us, put it all together and figure out strategies to carry forward. So it's been definitely very interesting, I'll say, but without a doubt, there's been big wins that I'm very, very proud to be able to speak of.
Thank you, Art. And this leads me to my second question, because it speaks about volumes on the wins, not only, of course, the negative impact that this has brought to us, but the wins, and the wins comes in the unity, as you mentioned, and both Leslie did too, as our hospitals have come together as one unified voice. And my next question will be addressed to Leslie. Leslie, during this unprecedented time, we have seen both of our hospitals come together for a one voice for healthcare approach. How important was it for you both to come together and show a unified front in times of uncertainty?
Hey, so I can tell you how important it was for me to be able to connect with Art and to start a partnership of working together. And, I'd known, so Art's been here for a while now in Brownsville as a healthcare leader. And I definitely we've worked on other projects together, and we're very familiar with each other, and have always, I think, maintained a really good collegial relationship. I've known that Art was a great leader. I've known that he had a great team. But what I knew more than anything was that Art loved his community and that he would do anything. And it just comes up, right? I mean, when I've been here, as long as I've been here, and I would say, especially, to our chamber members that are out there running businesses, healthcare is a very challenging business to operate in the Valley for a lot of reasons that don't have anything to do with why we love our job and do it every day. But there are just a lot of challenges overall in healthcare. But, you know, I would say of all of the places that I've worked in my career, in terms of operating a business viably, keeping the doors open, the Valley's been one of the hardest places to operate a healthcare organization. And I just say that because what that tells me is people who stay here don't stay here because it's an easy job. Healthcare leaders that stay in the Valley stay here because they love who they're working with, and they love their community. So there was, when we knew that we were going to be impacted by the pandemic, there's an incredible sense of responsibility, right? It's kind of a responsibility plus excitement. Part of you says, this is what we trained for, this is why we're here. And the other part of you says, oh my goodness, you know, the community needs us. This is, we don't have an option to run the other way or to not step up. We have to step up. And so when you say, you know, how did that decision impact us to partner together? It was the best thing that we could have done. And Art and I have shared our thoughts with other folks in other forums about it, but I do maintain that it was the best thing we did. Art hosted, it seems like it was a year ago, I guess it was a couple of months ago. Art hosted a forum with Dr. James Castillo, who's the medical director for the county public health department, to visit with our medical staff. So in his hospital, he allowed Valley Baptist to co-host this physician meeting where our medical staffs and really physicians from throughout the community were able to attend and hear firsthand from Dr. Castillo everything that he knew at that time, which is kind of interesting now, right? Because do you remember, Art, they were talking about hydrochloroquine, they were talking about remdesivir. I mean, there were a lot of these drugs and treatments that have become very much in the mainstream media that a couple of months ago were just starting to, you know, get discussed. And it was a really productive talk for the doctors. It was kind of funny because I was in Art's dining room, you know, in his cafeteria, and the doctors would walk in and they would look at Art and say hi, and then they would look at me and say hi, and then they'd take a double take and look back like, Leslie Bingham's at Valley Regional? You know, what's going on here? We must be in a pandemic. But it was, you know, it was the start of what I think has continued to be a really positive relationship that has benefited the community. We do more things aligned right now, I would say, than unaligned. So whether, you know, if Art has policies that come on PPE, or the care of patients that have acute respiratory syndromes or whatever, Art, without hesitation, will share those with me. If I get policies or guidance, I don't hesitate to share those with Art. And in the previous normal world, we probably wouldn't have done that, right? That's proprietary information. But I think even our companies realized this is going to be a local response. What needs to happen in Brownsville is probably different than what needs to happen in Houston, or what needs to happen in San Antonio, or what needs to happen in Nashville, Tennessee, or Dallas, Texas. And so I think our bosses gave us a little bit of leeway to start making decisions on how we were going to protect and care for our community. And so that made this partnership very, very natural. Then, you know, kind of sprouting from that, I would say, now we have a county response. So Art and I were able to share with our healthcare colleagues in Harlingen
Hello? Can you hear us? Okay, I'm so sorry. We experienced some technical difficulties, and Leslie, I do apologize to both. You were talking about how it came to a shock of how doctors would see you and Art both in the same place, and how that spoke of we're definitely in a pandemic, right? That we can see both of you in one. And if you don't mind me, of course, we missed the last part of your remarks. If you don't mind, of course, repeating that once again for our audience. And a quick apology to everyone. We did experience some technical difficulties, but we're back. And that's what happens when you're live. I think, like I said earlier, we're all learning together. So Leslie.
Yeah, no worries. So no, I was just mentioning too, Art had mentioned how the city and the county have engaged. And I think what Art and I were able to recognize really quickly about the power of and the benefit from working together for the Brownsville community, we were able to share with the county kind of in a larger scale too. So we now have a loose kind of coalition that's meeting on a regular basis with the other two med-surg hospitals in the county, Valley Baptist Harlingen and Harlingen Medical Center. We've also started working closely with South Texas Rehab Hospital here in Brownsville, Solera Hospital in Brownsville and Harlingen, and most recently engaging the local nursing homes that play a critical role in this too. So taking that original partnership that I've really enjoyed between Valley Baptist and Valley Regional, and then being able to share that. And I would say too that this, as Art mentioned, the county and city leadership have really been incredible and engaged in this too. And I think that they appreciate that the healthcare providers are aligned, right? I think it probably makes their job a lot easier. We've even done things like found ways to report data in a consistent format, right? So whether it's testing data or patient, treatment data, all of those kinds of things, now our city and county leadership have access to that too. I know, Esme, one thing, and Art can probably speak to this somewhat too, but the other thing that you had mentioned that you wanted to discuss in the forum was surge, capacity. And I mentioned that right now we're kind of maybe in more of the ebb than the flow, but definitely the work that the hospitals here in Brownsville and that the hospitals in Harlingen have done just to try to anticipate strain on capacity, because I think everybody's hearing in the media that the biggest concern would be if we had kind of a uptick in transmission rate with more infected folks that then yielded more sick people that needed to be in the hospital, and that how as hospitals, if we're already busy pretty much throughout the year taking care of people that have heart attacks, people that have strokes, families having babies. When the hospitals are typically tied up with a great deal of our capacity taking care of regular needs, adding this on top can be a real strain. And that's when you really risk the health of the community. So this county coalition that Art and I participate on, we meet regularly, we report data regularly so that the county knows at any given time how many of our hospital beds are full, how many of them we've allocated specifically for the care of these patients, and whether or not we start getting to what we call trigger points of where we need to be seeking additional capacity. And those plans, we definitely have those. They're probably way too boring for this morning forum, but just know that we won't be surprised by that. We do a lot of forecasting, and so there are plans for how we would handle excess strain on our hospital capacity.
Thank you, Leslie, for that. That, of course, brings a lot of peace of mind when it comes to, that's always something that we're constantly thinking of. What happens, should we have a second wave, as it's known as the second wave? And hearing from our leaders that there is a plan, and that of course, through this coalition, and of course through multiple leaders from the county working together and creating a plan, reassures us that, that we will be okay. And we hope, of course, that we don't have to get to those extremes, but that is a possibility as COVID-19 continues to develop, and the spread of it as well. All right, and this would lead me to you now. I have a question. It may be a little too long, and I'm sorry, but it reads as following. There are concerns about spread of COVID-19, which we just spoke about. What should someone who has another health problem and need to see a doctor do, followed by? Or what if you or a loved one who has a health emergency and are concerned about going to your hospitals in fear of being exposed to COVID-19 do?
Can you hear me?
Yes.
All right, very good. Thank you for the question, Esme. So before I go on to answer that question, Leslie, thank you very much for the kind words, and know that, that I have a tremendous admiration and respect for your years of leadership in a really tough market as well. So I think without a doubt, kudos go to you as well. In terms of patients that need healthcare, that are concerned about potentially catching COVID, I would say several things. First off, the data tells us, right, and reporting tells us that there are patients today that are terrified of coming to the hospital or going to your doctor because of the fear of catching this virus, when in reality they're suffering strokes, they're suffering heart attacks, they're foregoing surgeries that need to be done. And that's clearly not what we want our community to do. Hospitals, despite the fact that we have COVID patients and they were caring for COVID patients, we have so many different precautions in place to ensure that we minimize the potential of transmission to non-COVID patients. And so let's talk a little bit about that. In the hospital settings, and I know that many of these, if not all of these, Leslie and the Valley Baptist team are exercising on a daily basis, but we use universal masking. So all of our patients, at the moment they enter the hospital, get a mask. All of our staff are masked as well, as are our doctors that come into the hospital. They get a mask as well. So that's one layer of protection. Two, everybody, doctors, employees, and patients get screened as they enter the hospital as well. And so they're asked the questions, do you have a temperature? Do you have any GI symptoms? Have you been in contact with anybody who is positive or is experiencing symptoms? Have you been on travels lately? And those are questions that are asked by the CDC, and we follow the CDC directions, and we monitor the list of questions regularly, because we know that over the past couple of months, the symptoms have changed as the virus changes, and so our screening questions need to change as well to be in alignment. Other things that we're doing within the hospital is that we're keeping patients separate. And so those patients that come in either through an emergent basis, or to come in for elective procedures that need to stay overnight, or just general admissions into the hospital, are kept separate from our patients that are experiencing COVID-related illnesses. And so that's yet another layer of protection. And so my summary there is that there are so many precautions in place within the hospital settings to ensure that our doctors and our employees are protected. Our patients are protected as well. There should not be any major concern about the potential of catching COVID in the hospital setting because you need to come and have a surgery, or because you are having a stroke or you're having a heart attack, and you just would rather deal with that rather risk getting COVID. I'll share with you that that's just not safe, and that's not what we want our community to do. So be assured that there are many safeguards in place that have been in place for quite some time already to make sure that our patients coming into the hospital settings, to our clinics, our emergency room settings, private practices are safe as they seek care. The most important thing to remember is that as this plays out, and who knows how long or how much longer we'll continue to deal with this COVID, we must not forego care that we need, because that only adds to the need later on, and that's not a good practice. And so the other thing that I'll end with is that, you know, as we continue to exist in the time of COVID, we just cannot relax our guard. I know that there's a huge motivation to getting the economy up and going and getting our businesses back up and running. People need to work so that they can pay their bills, and I totally understand that. However, we should be doing all of those things, still practicing social distancing, still wearing face coverings, making sure that we're not congregating in very large numbers, making sure that we wash our hands continuously. Those are things that are going to have to become hardwired and part of everyday life for us for some time to come.
Art, thank you for that. In fact, that was question number 4 for Leslie, but Art took over. But you know, it's actually true though. That was one of her questions, because we're all concerned. Our governor mentioned how you know, how he released, of course, and initiated the plan to reopen our economy, to reopen for business, and that's one of the number one concerns. As you know, we continuously support the growth and of course sustainability of businesses as a whole. It goes back to what Art mentioned, and Leslie has, you know, we all have a social responsibility to continue to practice CDC guidelines, to continue to wear that mask, to continue to wash our hands. We should not forget at any time or at any point that COVID-19 still exists amongst our community and of course globally, and that COVID-19 is a serious matter. It should not be taken lightly. And as Leslie mentioned, it is also important to not forget and always keep in mind that it is our community that, of course, unfortunately, is being, you know, is suffering. And, you know, like she said, we know of existing deaths of our very own from our city, and that should not be forgotten at any point. Please continue to practice social distancing. We will, of course, you know, we're back in business. We're reopening our businesses, but we have to do it very responsibly, as Art mentioned. Now, I know that we may be pressed for time, and we do have multiple other questions. I may be skipping through some. I know. I hope you don't mind, but this is addressed to Leslie. Leslie, the results of the 2020 census will help determine how hundreds of billions of dollars in federal funding flow into our communities every year for the next decade. That funding shapes many different aspects of our community and provides crucial information for the healthcare sector. How does a fair and accurate census benefit the healthcare sector, and more specifically, hospitals in our community?
Yeah, so it ties back to what I mentioned earlier, and really not to sound like a whiner, because like I said, I think Art and I both share a love for the community, and the fact that it's challenging to operate healthcare businesses in the Valley doesn't keep us from doing that. It's a needed service, and we're going to continue, you know, to fight that fight. But as we know, you know, our Brownsville's socioeconomic challenges, you know, continue, thanks to organizations like the Chamber and every bit of work that Chamber members are doing out there to build thriving businesses. We, you know, we continue to have some local socioeconomic challenges. And so for hospitals and for physicians and for other folks operating healthcare businesses, we do get support from the federal government and from the state for the high amount of uncompensated care that we deliver. And that care is data-based, right? So from somewhere, those numbers have to come from somewhere. Art and I can't just tell the government that we're busy taking care of people that can't afford their care. We have to be able to demonstrate that in numbers. And then those numbers that we demonstrate are then predicated off of population data, right? So it's really important to have clear census data, because that drives those funding mechanisms that keep hospitals, and let's not make it all about us, right? Let's make sure that that's what drives funding for school districts and higher education and infrastructure support. So as we're right now focused on having to go through this pandemic response, healthcare is front of mind. And so I think that's why it's kind of an easy way to draw a line between the critical nature of having accurate census data and us being able to continue to provide valuable healthcare services. I've seen great campaigns. I mean, I guess what I would say is the grassroots campaigns for census, I think, have always been really effective here in Brownsville and in the Valley. We have challenges on why people don't always respond to requests for census. So if COVID response makes that a little more real for people, if people can draw that line, then that's great. I do think that, just as Art said, as we're protecting ourselves and each other by continuing to do social distancing and maintaining masks, it sure is nice to know that you can go online to do your census, right? You don't have to get physically close to anybody. You don't have to go into a government office. I think I did my census in less than 4 minutes online. It was a really easy process. So anything that we can do to encourage our community to be active in participating in the census would be great.
Thank you, Leslie. And with that, we want to invite everyone to, as you just said, just go online. We all have access to our phones, of course, at the office, at home. It's very easy. It doesn't take long. It could take 3 to 4 minutes, and everyone could just log in and visit census.gov. You will have access to that information. There is so much other information also regarding COVID-19 that's available. We encourage and stress the importance of really get yourself counted, because it is important, and your actual numbers do count, and it will impact the funding that comes to our area. Art, I know that you've done your census. You've been counted. I see you nodding. Yes, I know you have, and we're very proud of you. And I know you both, of course, promote this with your own employees, as it's very easy to do. So Art, COVID-19 has changed every aspect of our lives, reshaping society in lasting ways. Also, it has changed the way that we conduct business. It has changed the way that we live. How we continue to teach our youth to, and how it has changed healthcare, just to name a few. What does the new normal for healthcare look like?
Well, as I look into my cloudy crystal ball, I will tell you that I don't know. And I don't know that anybody knows. I think that there definitely will be life-lasting impact as a consequence of this pandemic. I will tell you that some of it is not that bad. When I think of how this has affected my personal life, I'm staying at home. I'm enjoying more quality time with my family. I'm doing some of the things that I have never done before, such as regularly exercising, all because, I'm not able to go to the restaurants that I typically love to go to, or do those social events that I enjoy. I also think that this is going to force us to be more innovative. And so look at what we're doing now, in this form. Previously, we probably would have been gathered around a table in some conference room or event center, and we would be having the same discussion. But today, because of the circumstances, we're using platforms that have been available to us for some time now, but now they're becoming more and more mainstream. I'll tell you, at the hospital, we routinely have meetings with our doctors and our staff, our board members. We haven't come face to face in a full-fledged meeting for a number of months. As a matter of fact, I think we have better participation now because it's easier for the doctors to be a part of those discussions without having to travel between their offices and the hospital. You know, we don't live in a really, really big city, but if you're a physician that has a practice that's on Boca Chica, you know, even though it's just 4 or 5 miles away from us, it could take you easy 20, 30 minutes to get there. And so I'm encouraged by that because that increased participation leads to better collaboration, leads to more well thought out strategies with better and broader perspective. And so all good things, right? You know, from a business perspective, I'm gonna say what we already know. You know, it's gonna be more of the same, but slightly different. I was watching the news yesterday, and I saw this one restaurant that's created big tables with like bumpers around them so that the patrons can go in and ensure that they are at least 6 feet away. Maybe that's going to be the new norm, right? Who knows? But it's definitely going to change for us. And the number one driver of whatever we end up with, you know, over the next couple of months, the next couple of years, is increased vigilance, is shared precautions, is making sure that we do everything we can to prevent the spread, so that I don't give it to you and you don't give it to me, and together, you know, we learn to adapt to the new norm. So I hate that I can't give you a real specific answer, but I just don't know that anybody's really figured it out.
Thank you, Art. And I think we all mirror the same sentiments. We are all reevaluating our life. I've yet to exercise. I'm not going to lie. I have not exercised. I'm hoping that I will. They challenged me yesterday through our virtual ribbon cuttings, our great friends at Orange Theory, and I said yes in public. That means that I have to do it now. So hopefully I'll survive those workouts. But, you know, we definitely want to thank both you and Leslie. Thank you again from the bottom of our hearts. We genuinely appreciate all that you and your team do every single day, you know, before COVID-19, during COVID-19, and after COVID-19, because life will continue. And as you just said, we don't know what the new norm is. Perhaps this is our new norm, and we will adapt, because one thing that we do every single day, and all of us do in our businesses very well, is adapting to the resources, adapting to the new norm. And that's what makes us so successful together as a community, because that's what we are at the end of the day. It is not the chamber, it is not just Valley Baptist, Valley Regional, it is Brownsville itself together with one unified voice, and, you know, fighting this every single day. We also know that healthcare workers, first responders, our city and county leadership have been responding to COVID-19 with professionalism and courage. And today, before we adjourn, you know, I want to ask, what would be your message to those heroes of COVID-19? And, you know, we want to make sure that they understand, which I know they do because they hear from you every single day. But now that we have this platform, what would be your final thoughts, and of course your message to all those in the front line fighting COVID-19?
So thank you Esme for having us both here today, and thank you for continuing to provide leadership for the businesses in Brownsville. We really appreciate, even though Art hates doing these things, we're getting where we can take our show on the road. But it really is, it's you know, if I were sheltering at home, which I have to admit, sometimes I fantasized about, you know, what it would be like to do that as opposed to being here, you know, all day, every day. But if I were sitting at home, I would really look for opportunities to try to find out what's going on out there. And I think providing this kind of forum, and hopefully we've shared a little bit of insights or information that people found valuable. But I really appreciate the Chamber making this an important aspect of what you do to get information out there to your Chamber members and to the general public. You know, in terms of the gratitude, I don't, you know, we had our hospitals had flyovers last week from the Confederate Air Force, really just, and I know the media ask us for thoughts, and typically that is what they'll say is, you know, what would you say to everybody that's out there on the front lines? And generally just what we see in terms of daily acts of sacrifice and heroism, I don't even have words for it. Like, I'm literally humbled just to be here. I tell people my job's the easiest one, right? Just keep the doors open and let everybody else do the jobs that they've all been trained to do. But literally, I don't know a single person in our collective universe of workforce, healthcare workers, I don't know a single person that said, I opt out, you know, call me when it's over, which they would have a right to do, right? I mean, there are people that work as healthcare workers that are high risk themselves. And if they put their own health first, some of them might not show up to work. I don't know a single person that did that. I've known people that are taking extraordinary measures to keep themselves and other people safe. And I think that's part of the heroism. But it's just, it really is, it leaves you speechless. It's overwhelming. You probably know, but a lot of your Chamber members have reached out in generosity to the two hospitals. Our staffs better be exercising because they're definitely well fed lately. We've had a lot of really kind local businesses and larger, you know, businesses donate food, PPE, all kinds of things to the hospital staff. So just thank you for letting me take a minute to recognize them, because it's really, they're the ones that are doing the amazing work.
Thank you. Thank you very much for those words, Leslie. Art?
Yes, well, Esme, thank you for allowing us to be part of this and allowing the community to get a feel for what Leslie and I and our respective teams are doing within the hospital to make sure that we take care of those patients that come to us, to ensure that we have continuity of care for our community despite what we may end up with related to COVID. You know, I want to say that our frontline healthcare professionals, our friends with Border Patrol and police departments and fire and EMS, you know, these are the people that signed up to do whatever it takes, right? They're not the type of people that have committed to do things only that are easy, right? They're doing the hard work. And that takes a special kind of person with a lot of commitment, and those are special people. And so I want to make sure that, you know, all of those constituents, to include our doctors in the community, get recognized for being a part of the solution and for being so creative and supportive and for being good partners, you know. But the reality is that level of commitment and resilience must transcend to those that aren't necessarily, you know, a frontline healthcare provider. People that are not in hospitals, people that are not in clinics or EMS have just as much a responsibility of helping ensure that we all take care of each other, you know, because that's going to be the number one line of defense in making sure we get through this and that we minimize the spread of this virus. And so just a reminder there, right? We all have a responsibility, even if you don't work in a hospital setting or you're not a nurse or a tech or a doctor. It's the human thing to do, to look out for each other. You know, I'll tell you also that our Mayor Mendez, Judge Trevino, those gentlemen carry heavy loads. on their back, and they have to be recognized for the leadership they're providing. Those are not easy jobs, and I think in light of everything that we're experiencing and the constant change, and I'm sure there's always more people that are criticizing what we do versus those that don't. They still continue to provide strong and consistent leadership, and their cabinets, their council members, their teams are supporting them as they provide direction for this community, and they have to be recognized. And then, I could go on, right? Because this is probably the easiest question to answer out of all the questions that we've discussed. But time and time again, I am just overwhelmed by the amazing support from our community. The flybys, the salutes from, sirens, and, the evening prayer in our parking lots, the food, the donations. It goes on, and it's not just from those organizations that you typically hear of. It's consistent across the board throughout our community. I'm just overwhelmed and so extremely proud to be supporting this community. And so I had to say that. I'm going to finish just with one more thing, right? And that's I cannot go away without just thanking our teams. Our teams are just amazing people. Our doctors, our board members, everyone has a role to play in this. This is not just somebody else's problem. This is our problem, and we have to be engaged. And I'm going to get on my soapbox one more time, but being engaged means that you're washing your hands, means that you're staying at home as much as possible, means that you're looking out for that family, for that loved one, or that elderly person that lives at home with you because they're vulnerable, right? It means doing all the right things so that we can survive this together. And so, I could, as I said earlier, go on and on and on, but just wanted to say I'm extremely proud of the Valley Regional team, and I don't know, but just a small fraction of the team at Valley Baptist, but I'm extremely proud of them also. Esme, thank you so much for letting me be a part of this, and Brownsville, thank you for checking in this morning.
To both, thank you once again. We know you're running the show and you're fighting this pandemic, of course, with the great support of your team, every single person that works in both hospitals. We want to thank, of course, our city officials. We want to thank, of course, our county. Our county has done a tremendous job. They have never hesitated to take our calls, and believe me, we call them often and after business hours because we have businesses asking, and we have also responsibility to attend to these businesses. On behalf of our board of directors, our great team, we thank you. And I wish I could do a standing ovation, but I'm stuck in between this little box right here. And because I haven't really exercised, Leslie, I don't fit. I really literally just push myself in and breathe in and sit down. So, this is just a very, very, very small way to say thank you. We applaud, your service. We applaud your efforts. And there's not enough words to really tell you how proud we are of every single one of you. So on behalf of your chamber and on behalf of my team, thank you for everything that you do. Yay! We're so proud. You can hear Danielle on the other side clapping. Again, thank you, and do know that we are here to support you. And if there's anything that we and our members can do, we're just a call away. Again, to all of us, all those that are watching, to all those that follow us, thank you for your time. We encourage you to continue to follow us through our social media platforms, through Facebook, through Brownsville Chamber, Instagram, and LinkedIn. We will share this information. Once again, this webinar is being recorded, and we'll gladly have it on our website available for those that have missed the opportunity, to hear to our great community leaders. Leslie and Art, we wish you the very, very best, and do know that we respect and admire everything that you do. Have a great afternoon.
Thank you very much. Thank you,
Thank
guys.
you.
Bye.